We've compiled a list of 15 early signs that you may have diabetes or prediabetes. Each of these signs can be observed by you personally. The first of these 15 early signs of type 2 diabetes is 1. Excessive thirst and polyuria, also known as frequent urination. When too much sugar builds up in your bloodstream, it draws fluid away from your tissues. This can make you thirsty and cause you to drink and urinate more often than usual. When your body detects too much glucose, it tries to eliminate it through your kidneys and then through urination. This is a complex biochemical process, but the key is frequent trips to the bathroom, even several times during the night. The higher the sugar level, the more urine is produced, leading to more frequent trips to the bathroom. People with polyuria can produce more than 2.5 liters of urine daily. The result of excessive urination, which is essentially the loss of water and electrolytes, is increased thirst, also known as polydipsia. The more water we lose from our bodies, the faster we feel the need to rehydrate. However, increased thirst can also be caused by other factors, such as physical activity or high temperatures. It's important to replace lost fluids with sugar-free drinks, ideally plain mineral water. Before we move on to the next sign of type 2 diabetes, let's take a moment to discuss self-diagnosis. A 2021 study, focusing on how patients interpret early signs of foot problems, found a widespread issue with misinterpreting and often ignoring early signs of disease, delaying proper diagnosis and treatment. When it comes to diabetes, delaying treatment can lead to significant differences in disease severity over a period of months or even years. That's why this list is intended to serve as a comprehensive guide to warning signs that you should not ignore and should discuss with your doctor if necessary. The statistics on diabetes are pretty grim. 1 in 10 people has some form of diabetes, and 1 in 3, yes, 33% of the population, has prediabetes. Most of these people are unaware of their condition. The second sign of diabetes is 2. Polyphagia, or increased hunger. When there isn't enough insulin to move sugar into your cells, your muscles and organs run out of energy, causing intense hunger. This is directly related to how diabetes works. Cells struggle to absorb sugar from the blood, and even though the sugar is constantly present in the blood vessels, it can't meet the body's energy needs. As a result, there's a lack of energy, and we feel tired. For some people, persistently high blood glucose levels can cause hunger. When cells can't absorb glucose from the blood, our bodies begin to secrete large amounts of insulin, a hormone that forces sugar into the cells. However, an excess of this hormone can cause a rapid influx of sugar into cells and a sudden drop in blood sugar levels. This action stimulates the appetite, leading to feelings of hunger. But this hunger can persist even after a large meal because our bodies are still receiving signals of low blood sugar. Let's take a moment to discuss the whole mechanism behind diabetes. What is it, and how does it affect the body? After a meal, our blood sugar levels always rise. This is because the carbohydrates we've eaten are broken down into sugar, which enters the bloodstream from our intestines. As it circulates in the blood, sugar is taken up by our body's cells and used for various needs, a perfectly normal physiological process. The problem arises when large amounts of sugar remain in the blood vessels for too long, a condition known as hyperglycemia. Why does this happen? For a variety of reasons, cells have difficulty absorbing sugar from the blood, resulting in a deficiency of this component. On the other hand, when sugar, that is glucose, circulates in the blood vessels for a prolonged period of time, it has a toxic effect on them, causing damage. To simplify, diabetes causes 2 problems. It makes it harder for cells to digest sugar and convert it into energy, and it keeps blood sugar levels very high for a long time, which can seriously damage our organs and overall health. The third sign of diabetes may surprise you. 3. Weight loss. Despite eating more than usual to satisfy hunger, you may lose weight. Without the ability to metabolize glucose, the body uses alternative fuels stored in muscle and fat. Calories are lost as excess glucose is excreted in the urine. In more severe cases, people who have had diabetes for a long time can develop the rather unpleasant Werner syndrome, which generally means accelerated aging with loss of muscle and fat tissue. This is often characterized by partial lipodystrophy, an inability to distribute fat properly. This leads to an overgrowth of abdominal fat cells, which are harder to burn and very different from fat cells in other parts of the body. To better understand the difference, I recommend you watch our video about losing belly fat and why it's different from other types of fat in our bodies. As a result, people with partial lipodystrophy and Werner's syndrome can have a large fat belly and very little fat in other parts of the body, hands, legs, buttocks, and face. In general, a large fat belly and skinny arms and legs, popularly known as a beer belly, can be a real warning sign. The fourth sign of diabetes comes as no surprise. 4. Tiredness. When your cells are deprived of sugar, you may become tired and irritable. Symptoms of elevated blood glucose levels can include chronic fatigue, which occurs even when we get a good night's sleep. As you know, our bodies need fuel to function efficiently, and very often that fuel is glucose. The mechanism here is quite simple. The inability of cells to use sugar leads to unusual levels of fatigue. 5. Headaches. Another common symptom of high blood sugar is headache. This is largely due to dehydration. In addition, excess sugar causes blood vessels in the brain to constrict and swell, which also causes pain. The headache may be mild and not noticeable at first, but if the blood sugar level continues to rise or remains high for a long time, the headache may become more severe. 6. Dry mouth and mouth infections. People who struggle with high blood sugar levels often experience dry mouth. This includes a rough, dry tongue, cracked and chapped lips, and the appearance of a burning sensation and ulcers in the mouth. In addition, dry mouth can cause difficulty chewing, swallowing, and even speaking. These symptoms are caused by, but not limited to, water loss. Experts have confirmed that, as a result of hyperglycemia, there is an impaired functioning of the salivary glands, leading to a decrease in saliva secretion. 7. Mood swings. Current knowledge also shows that elevated glucose levels in the blood can cause mood changes and be the cause of the appearance of bad mood, sadness, and even anger, but the mechanism of these relationships is not yet very well understood. 8. Problems with focus and concentration. If high levels of sugar remain in the blood vessels for too long, they are damaged. As a result, blood flow to the brain can be impeded. In addition, excess sugar disrupts the function of neurotransmitters, which can damage nerve cells in the brain. Add to this the increased risk of dehydration due to frequent urination, and the list of symptoms of hyperglycemia can be expanded to include impaired concentration and memory problems. 9. Slow healing. Sores or frequent infections. Type 2 diabetes affects your ability to heal and fight off infections. The skin of people with diabetes becomes less resistant. These symptoms occur because skin cells, such as fibroblasts, melanocytes, and keratinocytes, malfunction when blood sugar levels are elevated. People with high blood sugar levels also experience slower wound healing. This may be due to impaired circulation. In addition, hyperglycemia leads to the loss of the glycocalyx, a protective layer found in the endothelial cells that line the blood vessels in the skin. In addition, there is inflammation due to excess glucose, which is also not conducive to wound healing. 10. Areas of darkened skin. Some people with type 2 diabetes have patches of dark, velvety skin in the folds and creases of their bodies, usually in the armpits and neck. This condition, called acanthosis nigricans, can be a sign of insulin resistance. Hyperglycemia can also manifest as skin changes. These include itching, inflammation, peeling of the epidermis, and even darkening of the skin, especially in the neck, armpits, and groin. 11. Erectile dysfunction. A problem that obviously affects men. An analysis of more than 100 scientific studies shows that erectile dysfunction occurs in up to half of men with diabetes. Again, the problem boils down to damage to the blood vessels caused by excess glucose. Circulatory problems can result in reduced blood supply to the penis. In addition, In cases of hyperglycemia, there is a reduced release of nitric oxide, resulting in insufficient relaxation of the smooth muscles of the vasculature of the corpora cavernosa, responsible for penile stiffening and erection. In addition, hyperglycemia causes nerve damage that limits the transmission of sensory stimuli from the penis to the region of the brain responsible for erection. This is one of the symptoms of diabetic neuropathy. In other words, there are many mechanisms by which too much glucose prevents erection and intercourse. 12. More, inflammation and infection. Excess glucose in the body interferes with the functioning of the immune system. The result is an increased risk of infection. People with hyperglycemia are more likely to develop various types of infections, which last longer and are usually more severe. For example, people with diabetes are more likely to get urinary tract infections. This is because sugar in the blood and urine accelerates the growth of pathogenic microorganisms, including bacteria and yeast. For a similar reason, genital infections can occur. This problem most often affects women. Symptoms include itching and redness of the vagina and pain during sexual intercourse. There may also be discomfort when urinating and a thick discharge. 13. Blurred vision. If your blood sugar is too high, fluid may be drawn from the lenses of your eyes. This can affect your ability to focus. Untreated hyperglycemia and diabetes can lead to blurred vision because excess sugar interferes with the functioning of the retina. This is called diabetic retinopathy. In some people, fluid can build up in the central part of the retina, which is responsible for sharp and colorful vision. This leads to a thickening of this part of the eye. As a result, people with this condition see blurry and hazy images. Unfortunately, some people develop retinal detachment, which is associated with permanent vision loss. 14. Numbness and tingling in the feet and hands. People with diabetes and those who are pre-diabetic often complain of tingling and numbness in their feet and hands. This is because excessive amounts of sugar can damage sensitive nerve fibers. This is called diabetic neuropathy. People with neuropathy also complain of a burning sensation in their feet. They often feel a sharp pain in their feet, especially after lying down in bed. Sometimes these people uncover themselves while sleeping because they feel uncomfortable itch in their legs. 15. Stomach problems. Neuropathy can also affect the gastrointestinal tract. Symptoms include constipation, diarrhea, and bloating after eating. Some people with diabetes also develop bladder neuropathy. This usually means that the person does not feel the need to urinate even though the bladder is full. This leads to urine retention, which is one of the causes of urinary tract infections. Some people also develop urinary incontinence. 16. Serious consequences of untreated diabetes. One of the more serious complications of diabetes is diabetic foot, or ulceration of the foot, sometimes accompanied by deformity. The lesions usually affect the sole of the foot. The condition is also characterized by the absence of pain. So ulceration often develops to the point of tissue necrosis, which is an indication for amputation. The latest scientific data from 2017 showed that diabetic foot develops in just over 6% of people with diabetes. Elevated blood glucose levels also affect kidney function, leading to reduced glomerular filtration. This is followed by the development of proteinuria, hypertension, and edema. All this leads to renal failure, which in the long run may require dialysis therapy. Vascular damage caused by hyperglycemia also leads to the development of cardiovascular disease. People with diabetes are particularly at risk for stroke and heart attack. It is also worth mentioning that persistently elevated sugar levels promote the onset of periodontal disease. People with diabetes are more likely to suffer from gingivitis, periodontitis, and tooth decay. In extreme situations, a condition called ketoacidosis can occur. This is a condition in which there is a very high concentration of glucose in the blood due to a lack of insulin. At the same time, fat is broken down and ketone bodies are formed, which serve the body as an alternative source of energy to the glucose that the cells cannot absorb. Unfortunately, the rapid increase in the concentration of ketone bodies in the blood leads to its acidification. This problem is most common in people with type 1 diabetes. It is characterized by a noticeable, unpleasant odor of acetone coming from the mouth. It is similar to the smell of nail polish remover. This symptom precedes impaired consciousness and hyperglycemic coma. Who is at risk for diabetes? I will also mention that some people are more predisposed to developing diabetes, and it is these people who should take special interest in this topic and regularly monitor the level of blood sugar. I am referring primarily to people who are overweight and obese, as well as people who lead a sedentary lifestyle. People who have parents or siblings who have been diagnosed with diabetes are also at risk. Diabetes can also develop in the course of hypertension, increased triglyceride levels, as well as polycystic ovarian syndrome, or PCOS. In addition, the risk of diabetes increases in people who consume large amounts of carbohydrates, including simple sugars. The formation of diabetes is also favored by smoking cigarettes and alcohol abuse. I hope that the messages covered in this video will sensitize you to the occurrence of seemingly harmless symptoms, which, however, can indicate serious problems. Prevention is better than cure. That's why we are doing this channel, and that's why you should subscribe for more. Thanks for spending time on Doctor's Notes.